put simply, in South Korea, as you pointed out, it is quite taboo to be gay, lesbian, transgender. And this person visited these gay nightclubs in Seoul, which are not necessarily details that are relevant to this outbreak of coronavirus. However, some media zoned in on the fact that it was gay nightclubs that he had visited. And since then, it's been an outpouring of a torrent of hate online against this person and against the LGBTQ community in general, who are being scapegoated for this latest outbreak in South Korea.
I mean, it's a lesson for us all, countries that are coming out of isolation and looking at the opening up of these kinds of clubs, of any nightclub. But part of this, when an infection like this spreads, is contact tracing. Now, this has been a big problem in this instance.
Yeah, it's caused quite a big issue because South Korean authorities have, from the very start of this outbreak, been very good at contact tracing, tracing who was at a given place and when. During this outbreak, many businesses have actually been open. There has been no lockdown in South Korea. And one of the reasons is because South Korean authorities are able to legally access, say, telephone records, credit card records. The problem in this case is that the clubs were, legally open, and they take a log of all the people who went inside these bars and clubs. However, a lot of the attendees wrote fake names or fake phone numbers. So that means authorities are not necessarily able to know who was actually at the clubs. And they've been able to contact quite a few people, but a lot of people they have not been able to contact. And for obvious reasons, people did not want to leave their real names or identities because homophobia is so severe in this country.
Do you think it's possible that with the publicity, people who perhaps went to those clubs might try and get tested themselves privately?
Yeah, so the government is pretty desperate to get in touch with all of these people who were at these clubs. I mean, on the log, there were about 5,000 people. So now they have said that, if you come forward and do testing, it will be free, it will be anonymous. And all you have to do is just say that you were in this area on those days. That's all you need to say. You don't need to say you went specifically to these clubs. And they have said that relevant patient data will be deleted and will be, they will not disclose any information that may out these people or give any information about, who they are. So I think people are coming forward to get tested, and they might actually be some of those who actually attended those clubs.
I guess it's going to take a lot of trust on behalf of those people. As you say, this is a country that is very open about its homophobia.
Yeah, it's going to be a big challenge. And interestingly, this is probably the first time that the LGBTQ community has gained so much media attention in a country where, supposedly gays don't exist. So it's going to, it's a new thing that's on TV. It's very shocking to see, say, gay bars and clubs being featured on primetime news. I think many people were not even sure that these places existed, but they do. And now it's in the spotlight. And I think, now the conversation can potentially turn positively to start addressing these problems of discrimination in South Korea.
And do you think the government understands now with a health issue like this that they need to try and lead by being more tolerant themselves?
Yeah, I mean, I think the actual health authorities in question who are trying to track the coronavirus outbreak have been very good at not disclosing information that is irrelevant to the case. However, it does bring up the issue of discrimination in South Korea overall. Homophobia, as well as all forms of discrimination, have been left unchallenged for many, many years, if not decades, because there is no anti-discrimination law in this country. So I think it raises many questions as to why, this has been able to go on for so long. And hopefully the government will tune in and realize that, if anything, now is the time to start talking about possibly criminalizing discriminatory behavior.
Raphael, I appreciate you bringing us that story. Thank you so much.
Thank you.